Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist, fertility acupuncturist. Today we're gonna talk about male testing, male infertility testing, male infertility testing. This is our topic today, and we're gonna talk about this. And I'm going to talk about this. It's important to know of, very, very important, okay, when it comes to male infertility. Let's do some search, just figure out everything. Okay. All right. Now, I don't know whether you know about that or not. When it comes to male infertility, the semen test is the first thing that we actually talk about. Okay, it's very, very important. Okay, very, very important. Okay, we're gonna talk about a few of the sperm conditions. What is the standard of the sperm semen conditions? Okay, and what is the normal range? Okay, the normal range is very important. Why it's so important? That is because the sperm meet the eggs that become embryo, right? And the embryo implant in the uterus, that then things happen, right? So without the semen, without the sperm, that you can't just treat the female infertility and forget about male fertility, right? Because without the male, without the semen, that is not gonna happen and conceive, isn't it? So that is equally important when it comes to infertility. That's equally important. So that's very, very important that you know that, and you get your patient to know that if you suffer from infertility issues, you have to test both, not just because, as I mentioned before, in Chinese culture, most people think about in the old term, they think about, well, if this couple can't be conceived, it is woman's fault. It is not. It is not, okay? It's to do with the man as well. Okay, so the research said is 1/3 infertility causing from woman, female, and the other third causing from male infertility. So you need to understand that. All right, so it's equally important. Hi, Veronica, how are you? Thank you. Good morning, and I'm doing well, thank you. Then let's check the other. If you on this live video, please say hello to me, and please tag your friend and family in if they interested in infertility topic, and please share with your friend and your family. Okay, share if you're on Facebook, on Instagram. Okay, thank you. All right, let's keep going. Let's start. Roll with me, acupuncture and holistic here. Hello, they are. Hi there from Florida. Thank you. Thank you for saying hi to me. What's your name actually? but I recognize that you'll grow with me, acupuncture and holistic care. Okay, I'll remember this. Okay, when we come to male infertility testing, okay, we need to talk about when should you go and see your doctor. Okay, again, is men should plan to see the doctor after a year of trying to conceive. Nothing happened, so there's something that you needed. Lydia, oh good. Okay, Lydia, I think you're on Facebook as well, right? Great. And you were on our webinar for local balance as well. I think I recognize you. Okay. Now, of course, it always comes to physical examination and the lab exam. Okay, so always come to those two things. Okay, so we suggest that fertility testing, okay, start with the male partner, as the procedures are usually much simple and less invasive than the testing carried out on female. Okay, because testing for male is simple. You just take blood, giving blood. That's for hormone test, and do a semen test, and none of them is, just taking blood is a bit painful. It's not invasive at all. For female, it's different. You might need to do laparoscopy and a lot of other things, to figure it out. It's more complication in female testing that we talked about yesterday, right? So male testing, male fertility testing can be broken into three, a few different category. Number one is physical examination and semen analysis. This is number one. Okay, number two is hormone assessment. And number three is further testing. That's potentially including scanning, biopsy, genetic testing, and further physical examination. Right. So having said this, the physical examination and semen analysis are usually sufficient. So this is the most common one is we get physical examination and semen analysis. Okay, then we need to talk about when is the best time to do the sperm test. Okay, once the results from this test arrive, so you can discuss whether further testing is required with your medical practitioner. Okay, so because it's so simple to do all this tests, but we're going to talk about what is the content of the sperm test. You probably won't get everything that you need from the test. Just like in New Zealand, compared with in Australia you can get much more details. And in New Zealand is so difficult when it comes to morphology. And why is the reason that they don't give you morphology? Okay, I don't know why, but we can discuss that later on. Okay. Now, physical examination and semen analysis. A physical examination will be carried out to check for any visible evidence of physiopsychology problem with the testicles. Okay. I don't know about you, whether you know, but when it comes to infertility, and the first thing that I ask the male one is pretty simple. This is the question that I must ask all men. Do you get erection in the morning? First thing in the morning, they have to have erection. They don't have erection in the morning. According to Chinese medicine, the kidney functions start getting low. Some of them, out of 7 days a week, they just want 1 or 2. That's not good enough. You treat them, and they get erection daily, every morning. I'm talking about every morning. Okay, you can miss 1 or 2, and it's fine. But definitely, most of the time, every morning erection. And while we treat the men with acupuncture and Chinese medicine, this thing need to change. Okay, they need to go every morning erection. So this is very, very important. Just let you know the first. Okay. So when it comes to so if there is no erection activity happen, if they can't go for a normal sex life, and that's a problem. So what do you treat? You treat the erection dysfunction. Okay. So this is very, very important. The first thing. Okay. If anything with problem with the ejaculation, such as delayed ejaculation or retrograde ejaculation, or the ejaculation is too fast. Okay, all this thing acupuncture and Chinese can help. Okay, all this thing talking about is the internal organ functioning. It's an issue. It's a big issue, and you need to work it out. Normally, what we look at is the kidney function and the liver function. Okay, but in reality, not just those, because all organs out of balance, it can cause this ejaculation problem as well. So you need to really figure it out, to ask all the questions. Okay, and very first, when you see patient, you always go for general health. So what is general health? Why general health? Because you want to work out what organs are out of balance. Okay, and general health can actually tell you and give you a lot of information about the organs health. Okay, does it make sense? So this is how it happens. You should ask about the sleeping, bowel motion, urine, and bloating, any bloating, tummy pain, and the energy wise, and stress level, any pain in the joint or muscle. All those things are important. When you go to general health, you work out what organs are out of balance according to Chinese medicine. Then when you treat this patient, you need to treat it according to the diagnosis. Not just focus on, okay, you have sperm issues, low quality, then we just treat the sperm, and the sperm, according to Chinese medicine, is from the kidney. We just treat the kidney. That's not how it is. You can't just do that. If there is a stomach and spleen problem, treat the stomach and spleen problem. You may want to test out whether there is anything wrong with the kidney. If there is kidney, then treat the kidney as well. Or you treat the kidney as well as stomach and spleen. Get the general health settled as you go with treating the sperm issues. Okay, low sex drive is another problem. Oh, a lot of patients have this. Why is that? Because too busy, stress related. So low sex drive is not necessarily just the kidney problem, according to Chinese medicine. It can be too busy, okay, or can be emotional. When I say emotional, it's relationship that's in a bad shape. Okay, so as a practitioner, you need to understand all this. The best thing is for both couple came to the treatment, came to the examination. You ask all the question about it. I find that if both partner came they will stick with the treatment because they understand each other. But those just come single and get the treatment done, and if the female come for treatment and the male didn't want to come, the male thing is necessary not necessary, or they have a child before that, and they keep thinking, the men keep thinking that I have no problem, I didn't want to get tests, and that won't stick long because that we know the female has problem, we keep treating the female, but we keep missing out the male one. Because another third of infertility is the female and male both have issues. So you can't just test one. You know, I have patients who come to me, just female come, and the male refuse any test. Refuse any test at all. And we keep treating the female, and the female get better and better and better, and nothing's still happening. And we keep reminding, you need a semen test. We need to see a semen test. But in the end, they just give up. So it's more important when you see your patient, you need to suggest that bring me the semen test. Yes, we can start chasing up the patient, okay? And I have my some of the acupuncture, fertility acupuncture, they won't see the patient until they have all the tests. There's another way to do it, okay? So I'm still finding my way to get the men come to me, okay? Some men, no problem, they just came. They do all the tests, you know, and some not really. But if you see that the men come and support the female and the female support the man, and they get pregnant faster, definitely, okay? Because they both on the same page. Doesn't make sense to you. I don't know about you, because if you see a lot of fertility and you know, too expensive to do morphology test. Okay, yeah, we're gonna talk about that as well. I don't know about the cost of it, because in here it's all free. It's all free in here. The government pay for it, all the tests. You don't have to pay anything for it. Okay. So that's the story. You don't have to pay anything for it in New Zealand. So we are so lucky in here. But yes, you're so lucky, but there's a problem for it. There's a big problem with it. Even the patient want to pay for them, they can't do it. They can't pay privately. Okay, so this is important too. Okay, let's keep going. If the men have pain or swelling in the genital area, then you need to test it out. This is physical examination of the tummy, the men around here, and even though the groin. Okay, don't just go through the tummy, groin as well. And groin and what? You need to press, palpitate the thigh as well. Okay, so those are very, very important to test it out in physical examination. Okay, once you take all the medical history, okay, you need to know about, like in female as well. Once you know about the overall health, you need to know about the sexual history. Okay, because all this gonna affect the factor. What is the sexual history, like low drive, sex drive, or delayed ejaculation, or erection problem, all those things. Okay. On the other thing is whether they have any surgery in the genital area. So this is another key. If they have, then we need to think about, is there anything wrong with that, with the surgery? Okay, did they cut something that is not supposed to be? Just kidding. But yeah, we need to know this. What is the surgery for? You know, actually, and would it be too close to the genital area, and that actually give the dysfunction causing from the surgery, right? The semen analysis. Okay, the semen analysis is a big part of it. Okay, we get the patient do it straight away before they come to see us, or as soon as they come to see us, we want them to do that. It's a requirement. It's a requirement. Okay, so that's why I say that in Chinese practitioner, if you are fertility acupuncturist, you can't just take the pose and ask the question and see the tongue and forget about the semen test. The semen test has become very, very important. I would say is the #1 things that you need to get your patient to do. Okay, you can't go without it. Even though they're perfect and they have full energy and no pain at all, but the semen may be abnormal. Do you know that? You probably don't know about it. Okay, because semen, because we use cell phone right now. Oh, our cell phone is in here. We use cell phone right now, like this, right? The cell phone right now, and the cell phone, the mobile phone, put in the pocket, it can actually harm the sperm very badly. It kills the sperm. It kills the sperm. So the first thing first, ask your patient, do not put any cell phone in the pocket. Right? Carry on hand, or turn it off before you put it on in the pocket. Most people do that. I used to do that. Not anymore. When you read the test and the study, they scare you off. Okay, this is very important. So when to test the when do you do the test of the semen? When you do the test of the semen, it's mean 3 or 4 days. You make sure 3 or 4 days no ejaculation before you get a semen test. Okay, it has to be ejaculated into the a clean container. Okay, the best is do it in a clinic. Okay, do it in a clinic. And then what is the test? If you have any illness or any medical issues, it can affect. It can have an effect on sperm health for the period of 3 months. Okay, if you have any health issue for the last 3 months, okay, it can actually affect the sperm test. Okay, so you need to actually discuss your health issue to the doctor, and the doctor should suggest you do not do it until after 3 months. So those are important to know of. Okay, when you do the semen test. Okay, now what is the actual content that we're testing for? We're testing for, according to the WHO, the normal range of the semen. There's a few things. With the sperm volume, sperm concentration, and it comes to the proportion of the sperm molecule, which is the and the proportion with rapid plus slow motility. Okay, and proportion of sperm with a normal shape using strict criteria. Okay, the volume, it has to be more than 1.5 ml to consider that it's normal. Okay, and the sperm concentration should be more than 15 million. What is 1.5 ml? one is 15 million. So it's a bit easier to remember because it's all 1515, right? Okay. Now the proportion of sperm motil is 40% or more. Okay, this is okay. Okay, proportion with rapid plus slow motility 32%. Now I had patient the day before on Sunday, and with the motility is actually 44, right? Which is normal, right? But they've been trying for even more than a year. Then that is nothing happening. So we are talking here about how to increase the fertility rate. You know, increase your chance to get pregnant, to conceive, right? So that's 44, but there's 22 that is actually not progressive, not moving forward. It's just moving, stay in there in one place, 22. And there's 33, 30 something that is not alive. 33 not alive. Stay there, not moving. What do you think about them? Maybe they die. Or maybe they lack of energy, to stop in there, not moving. I said to the patient, I say, let's say you have 44 right now. If you get half of it that is not is moving around, that moving, or 45, sorry, that's 45 and 22 and 33, and they come to 30, 50, 54, yeah, 100. Okay, now the 22 sperm is moving around. It doesn't move forward. Moving forward is important. Okay, you don't want to just move. So moving around, not forward, doesn't count. If you get half of it, 22 is moving just around, just get 11% to move forward, then you increase the mobility moving forward one from 45 to 56, right? 56. Now, if we say, well, 33%, that is actually dying, not activities in there. Saying there, you don't know whether they die or what, maybe they die because you keep a cell phone in the pocket. I say, it's very many chances it's already die. 33%, that's very high. So you get half of it, let's say 15%, that is you moving from die to moving forward, okay? And that's 46 plus 15. That is 50, 59, It comes to 60%. Oh no, hang on. 50, 45 plus 6, 50, 56 plus 15, 56, 60, 70. There's 70% of the sperm that are actually alive and moving forward. 70%. So I said, well, we are talking about increasing your the quality of your sperm, as well as that, therefore your fertility chance rate will increase, right? So increasing the sperm quality is rather important because you're increasing your chance. You can't just work on the female. Does it make sense to you? This is how I talk to the patient. And how do they do that? How do they do that? Lifestyle is very important. Avoiding the cell phone in the pocket is very important. Okay, so then get in 2 or 3 months, get another semen test. 2 or 3 months, and he happened to have pre-diabetes. So pre-diabetes is a condition, which means the diet his diet is not good, and the wife had diabetes. It was even higher as higher than 41, and that is a problem in the blood test, and she actually have 45. I think it's 45, right? Yeah. So this is the case, a real case that we talk about this. This is a real case we talk about this. How do we do this? And okay, come to the morphology. I need to talk about morphology. Okay. And when I look at the morphology, yes, it makes sense, doesn't it? So it totally makes sense when it comes to Chinese medicine. When you come to the, because the patient will tell you it's normal. So on Sunday, I asked her, because we just have a initial examination with the female, okay, and the female said, well, yes. I said, well, the thing is, I haven't seen you send in any semen test of your husband. He said, yes, we have done it. It's all normal. I said, don't tell me normal. Show me. Show me. I want to see what's normal. Okay, what's normal? Yeah, the sperm motel is above 40. It's normal, 44. But it can be even better. What about the 30% will die? How do you get it all alive? You see what I mean? So you need to see the number. If they have a report, a test, you need to see it. You can't just trust your patient and say it's normal. Okay, I trust it's normal. A lot of it's not normal. A lot of it can be increased. This is how you read it. For the Western, they say it's normal, nothing to do, because they can't do anything for sperm. IVF has nothing to do with sperm. They can't help with sperm quality problem. And they can't help with the shape, morphology. What is the shape? You have a head, the sperm, and you have a tail, right? This is head, this is tail. It need to move. If the shape of the head is wonky, or the tail is, it's wonky, the shape is not normal, then this is not gonna be healthy. Okay, I want to tell you the truth. We all follow WHO normal range. Now you really want to doubt whether you can still trust WHO or not when it comes to here. I doubt it. 30 years ago, in my mind right now, I think it's about 30 to 40% of morphology. I can't remember clearly. I think it's 30 years ago. It has to reach 30 or 40%. Not exactly right, but it's very high. Okay, I think it's 30 to 40% of morphology, or more than that, to be considered as normal. And after about 10 years or 15 years, they lower to 15%. 15%. Then and now they lower to 4%. 4%. Now, this is very important, eh? You need to listen carefully. If you're a patient or you're a practitioner, why is that? If 4% is normal, if your patient morphology is 6%, 6%, and from now it's normal, but 30 years ago, 6% is abnormal. You see what I mean? Why? What is the reason? 30 years ago is about 30 or 40% range to consider a normal standard. But why is it after 30 years that dropped down to 4%? And I think 10 years ago it was 15%. Why did it drop? Have you ever thought about this? Why did it drop? There is no, that doesn't make sense to me. And the other remain the same. Why would this drop? Based on what it dropped the standard? Based on what it dropped the standard? First thing you need to know is the IVF If they come up with, well, the main, if you are 10%, you are normal. The man is fine, and that's woman problem. If they have a clear diagnosis, your infertility is due to the man. We discussed this with my master. Why did it drop? We're guessing. I'm not sure whether it's right or not. We're guessing with IVF business. If they said, well, if we come to 2 or 3%, let's say, and now 4% is normal. If 2% of semen, what can they do? They can't do anything. Sorry, we can't do anything. There's no treatment for you. Or there is no, what? If there is no semen, what can they do? They can't do anything. They can't do anything for sperm. Right? They probably have to donate sperm. Does it make sense to you? So when it comes to, when patient get morphology is 5 or 6 or 7, and that's normal. For them, it's normal. They can do IVF. We're just guessing. We're not sure whether it's right or not. So WHO, whether we can trust it, there's something that we can't trust it. You can't fully trust WHO. I'm sorry, I'm saying in here. This is how I feel. I'm not trusting WHO fully, to be honest. Especially when it comes to this. I doubted why morphology will be lower and lower and lower until now it's 4%. That doesn't make sense. Okay. Unfortunately, in New Zealand, they only tell you it's normal. When it comes to morphology, and most of the time they don't give you morphology test. Maybe, yeah, according to America, it's too expensive. Maybe it's too expensive. They don't want to let you know. They don't want to do it. The last patient that I saw on Sunday, she showed me the husband's semen test analysis. There's no more morphology. And I asked him, you have to do another one, morphology one. Because we don't know. The morphology, we really want to know about the numbers, how many percent. According to my master, he said anything above 10, and they can get pregnant naturally. If lower than 10, the morphology, you need to treat them to increase the morphology. From anything below 10 to above 10. Okay, it doesn't need to be 40, 30, you know, in experience above 10, then they can get pregnant. Does it mean? So the main, so I will fighting with the lab person, get my patient to fight with them. I say, well, you need to know the number, you need to know the number. Until now, they can't get any number. They just say it's normal. I think it's normal, it's not good enough. It can be 5 or 6, it's normal. But for me, the men need treatment. That is not normal, not good enough. Right? So if you're treating infertility, you need to know this. You really need to know this, okay? You need to have this information. So do not trust your patient say it's normal. Every time when they say it's normal, you say, yeah, can you please show me the report? You need to see it yourself and then to explain to your patient what's going on, what they mean, because none of the doctor actually tell them how to read the report. That is very true. Okay, you need to understand this. Okay, more tests, hormone tests. Okay, if everything's fine, or if the quantity of the sperm or the quality, not quantity, sorry, the quantity of the sperm is consistently poor, then a hormone test is required. Okay, you need to carry out to investigate what else is happening in the internally. Does that make sense? You need to take action to do that. Okay, what is the test of it? Okay, FSH, you need to test this. LH, or the other one called SHBG, which is 6-hormone binding globulin, and bound and unbound testosterone. Those are the thing, the hormone that you need to test out. Okay, so it's much simple when it comes to male infertility hormone test. You know, it doesn't take a bunch of it like female. Okay, we just test it. And female need to test thyroid and a lot of others, isn't it? We talked about yesterday. So those are the things that we talk about there in here. Okay, so be very keep in mind any illness or medical conditions, it can have an effect on sperm health for a period of 3 months. Okay, so prior to the test before taken, so it is best to discuss this issue with your health provider. Okay, so I need to further tests. I should mention further tests. What is the further test apart from the hormone test, apart from semen test, is the genital ultrasound. You know, you need to do that. In some cases, if they've been kicked when we're little, you know, playing football and they kick in underneath and it's sore for a while, or swelling, or urine issues, you know, then if they have accident in the past, then you want to get the ultrasound sometimes. Okay, and genetic testing. Okay, genetic testing is important. You need to go and get the DNA test, sometimes biopsy too. Okay, so all these are important. Okay, that's it for today. This is a sharing, it's not a teaching, and I'm just sharing my experience and as much as I can. And I have some note in here actually to tell you that what's going on, because all this thing is about Western medicine as well. So you should make a note and take a checklist, and we have a checklist to help to our patient and what to do in this examination and what to tell our patient. And you need to write down for you know, put in a paper. If you see a patient, we actually print it all out and hand it to patient. This is a test that you need to do. You know, tell patient what test they need to do and bring it to the doctor, because the doctor may know what exactly they need to, and you can't just tell your patient to remember all this. Too complicated. We write down in a paper, or we print it out actually, and we just take whatever they want, and things that they don't need to, we cross over, you know, and then give it to a doctor. Okay, so these are important. I hope this is a valuable information for you. If you think this is valuable as well, it's good share, please give me a thumbs up and let me know it's valuable. Thank you very much and stay awesome. I'll see you tomorrow. Thank you, Veronica.